Former patient Gordon Newman is now enjoying his well-earned retirement, but 26 years ago his life was blighted by the condition trigeminal neuralgia, often referred to as the suicide disease, because the pain is unbearable.
The pain was such that the slightest of touch, the pain was deeper. I couldn't brush my teeth, I couldn't eat, I couldn't move. It was so excruciating, I just had to stand still, lie down, or, on many occasions, cry. And it was so bad, it affected all my family, my children, my wife. They could do nothing, and it just got worse. You cannot believe, you cannot believe the pain, unless you've had it, and I wouldn't wish it on my worst enemy. You cannot believe the pain. And the thing about it is that the slightest of touch, the more excruciating the pain was. I.e. driving home with the car window open and the breeze just brushing your face. It was horrific, absolutely horrific. All you could do is get home. I couldn't even take my coat off. The pain was such, I couldn't move until it subsided, and eventually we moved and phoned Pain Relief Foundation and had another operation.
Gordon kept going back for a procedure which numbed the side of his face. The effect lasted a couple of months before the pain returned. Eventually he was referred to neurosurgeon Professor John Miles, co-founder of the Pain Relief Foundation, who told him the only answer was brain surgery, to separate an artery which was resting on the trigeminal nerve and wrap it in a tiny pad.
I was very reluctant because I knew that it was quite a serious operation. John did tell me that the brain didn't like blood, but we had to go in and have a look. We went out, my wife and myself walked away, walked round the grounds, and I said to my wife, "Got to do it, love." Went back, knocked on his door, went in. He said, "You coming in?" I said, "Yes, I'd like it done, John." This was a Friday. I came in on the Sunday. I was operated on the Monday, and I went home on the Tuesday, pain-free. That's unbelievable. Still bring tears.
A university chair in pain science is funded by the Pain Relief Foundation and held by Professor Turo Nurmiko. He explains what his team of researchers are trying to achieve.
Well, the Pain Relief Foundation has been instrumental in founding a laboratory which is dedicated for research in chronic pain. And that already has provided several pioneering studies that show that chronic pain in fact is something that we can understand more from research and help to treat patients. We need to understand more about how the system that normally mediates pain, something that I call the pain mediating system, has gone wrong in the case of chronic pain. We already know that nerve endings become very sensitized. We also know that chemical changes happen in the central nervous system for which we can develop drugs. But most importantly, we now understand more and more of the role of the brain in how it perceives pain. And here the Pain Research Institute has extraordinarily good chances of looking into the matter. There's obviously quite an urgent need for research, and as the population grows older, the need just increases all the time.